Welcome to September 10th. It is 12:04. And let's just get started nice and slow. Nice and slowly together. Something to hold. Something to feel. Inviting the breath to take up space inside of the body. Allowing the body to connect down into the bones, into the earth, into gravity. I see there is a lag. Try not to worry so much about it. More gravity. Ooh. That would be a fun experiment, wouldn't it? Bringing my heels up off the floor, feeling the vertical relationship up to down, in and out. Letting go what I'm done with. I have something that feels important to talk about. But I see that my connection is running slowly. So we might keep it short today. But just listen for another moment or two. Feel gravity on your body. Breathe in and invite the breath to take up space. Feel the solidness of bones anchored down into gravity, and feel the fluid elastic of breath filling into the space. And let your breath move easily, like waves, with a pause at the top, a pause at the bottom, the pauses are important. They're not forced or manufactured or held. It's just part of the oscillation, part of the flow. And slow your breath down enough that you can rest in the pause just for a moment, and then soften down into the next cycle. And give your body and give your mind and give the voices and the stories and whatever other noise is there, give all of that permission to just pause. Before whatever it is that's happening next. Permission to pause. Permission to exist is the theme that has come through a few times here this week. Permission to exist. Because there are a lot of us who didn't really get that early on. Not in a way that we could feel in our body that was safe and trustworthy. There's perhaps a skepticism, perhaps an anticipation of like, really? What will happen to me? There's not safety, there's not trust in that permission. That permission maybe felt like a trap. And I will speak briefly because I see that the lag isn't really going away. But I'm taking a continuing education unit right now that is about neurodiversity and autism treatment in the classroom. And I'm listening to an occupational therapist who's presenting the material. And she's describing the goals. Goals are very important. Goal writing is very important for a school-based therapist, especially. Goals are important for all of us. And the way that we shape our goals, the way that we verbalize and identify and clarify and work towards our goals helps to define our trajectory. And this occupational therapist is sharing that the way she was taught to write goals for her school children, she realized that they were built around the ultimate goal of minimizing the level of distraction that this child who has some sort of neurodevelopmental complexity that is making the classroom environment difficult for the child to exist within. And her role as the therapist was not actually to make that child any more comfortable. She was trained to write goals around minimizing the distraction and minimizing the discomfort experienced by the child's teacher, peers, etc., by the environment. Whereas the child, who is in reality her client, was being neglected by this approach. And this is what she was taught to do. I don't work with children at this time. I don't have expertise or personal experience to share about what it's like to work in a school system. But I can see these goals making a lot of sense. Truly. I can in the therapeutic world and the way that we think about activity participation, for that student to be able to blend into their environment, to minimize the distraction that they're creating, and to turn into just one of the kids in the classroom, would have been desirable. I can understand how that would have been desirable, and that would have seemed like a very reasonable, rational goal. And yet, this therapist, occupational therapist, started writing her goals differently to center on the child and to center around the child's ability to participate, evolving. And I'm not done with this particular unit of education yet. But that's kind of where I paused in her presentation. And I wept. For the children who have been taught from the beginning that there was something wrong with you, that the way that you are, the way that you exist, and the way that you experience your life is inherently problematic for everyone around you. Those kids were taught to not exist, to mask, to hide, to blend, to behave. And that is what their success was defined by, was their ability to do those things. I think many of us have had some version of that experience for whatever reason. All of the reasons make sense. The question is whether you are willing to give yourself permission to exist as you are, to feel what you feel, to need what you need, to want what you want. And all of the logistics and details we will talk about. But for that sort of basement level existence, call it your inner child if you want to, that basement level of existence that is honest and visceral, and maybe doesn't behave itself perfectly all the time. And it has big feelings and big energies that need to move through that focus point, that perspective point, that vantage point. Big feelings and big energies that are moving through your awareness in the moment. Pause. And just allow them to exist. And then soften down on your exhale. And we'll see what happens next. And we'll see what questions we need to ask. And we'll see what new pieces of information we can elicit from our environment and from the people around us who care about us and who support your permission to exist. Your body is an ally in this because your body is holding all of these feelings and all of these energies and all of these truths. Your truth, my truth. The body holds these things until we're ready to receive them. And when we fight and repress and inhibit and mask and hide, then nothing happens and nothing changes. And it's exhausting. It'll give you inflammation. So I think that's what felt really important today. And what I have written on the board is unbridled permission. Because I just really liked the way that unbridled sounded when I was thinking earlier. Unbridled. Like wild horses. What else? What else? I did bring my metronome in here today, so I'll show it to you briefly. And I like that it's analog. So it's all, it has to be wounds. Because it really exists. It's physical, it's tangible, it's mechanical. It exists in a way that is different than an app or something electronic, something virtual. There's impact, there's vibration, just holding it. I can feel that rhythm. And rhythm is medicinal. Rhythm is therapeutic. Rhythm is healing. So holding a metronome, finding a rhythm in your body, finding a rhythm in your breath, finding a rhythm in your existence. It's good for you. It's good for me. It's good for all of us. 22 minutes. I'm going to stop there. Gratitude. And I will see you next time.